I'm Professor Andrew Wilson. I'm one of the co-directors of the Australian Prevention Partnership Centre, Prevention Centre for shorthand. And we've been doing this enterprise for some 10 years. It's one of the largest enterprises in the prevention of chronic disease space in Australia. It's a collaboration of research, academic institutions and agencies with interests in the area of prevention.
Mainly we do research focused on the prevention of chronic disease, so things like cancer, heart disease, diabetes, mental health, all those sort of non-infectious chronic conditions that have a real impact on people's lives. The most important thing about the work that we do is that it's the research that's going to be relevant to inform policy and practice. So the priorities and the type of questions that we address are really identified by our policy partners. It's a long-term effort. Even if we implement some of the most effective policies and programs, they can take 10 or 20 years to have an impact, and that is a real challenge with chronic disease prevention research.
The most important thing that I sort of reinforce in relation to prevention is that it's not just about keeping people out of hospital. So it's not just about stopping people getting sick, it's actually making their lives better in that regard.
Not just the condition itself, but actually what are the sources and the causes of those conditions, to understanding the complex problems of chronic disease, but also to solving those complex problems. Looking at things like, how does the environment impact on chronic disease? How does advertising of junk foods influence what people eat? It's not just about people's individual choices, but it's about the options that they have to eat healthily. How does the public transport system influence the way that people are physically active or not?
One of the things that we have prided ourselves on is that when we make commitments to our funders to do things, we do them and we deliver them on time. It's absolutely fascinating, and it's probably been the best 10 years of my life in terms of the engagement with people. What it has allowed for is it's actually provided a mechanism to actually come together and work collaboratively to get research which makes a difference to the decisions at an individual level, at an organisational level and a policy level.